Good evening everyone. Please let me know if the audio video is clear. Hi बच्चों. Good evening. Whosoever is online, please let me know if the audio video is clear. आज हम पढ़ेंगे क्या? ECG, Electrocardiography. Electrocardiography. I am waiting for the reply so that I can start. Chalo, let me know if the audio video is clear. Good evening, Incredible Kumar. Chalo, so today we are going to learn about the, thank you for the reply. Today we are going to learn about the ECG, Electrocardiography. Okay, so let's start. ECG. It's very important topic. Not only for your exam purposes, bachcho, but your overall medical career is going to revolve around this ECG. Okay, so it is very important topic. Medical desires. Hello. So we are going to learn because see, in your exam the short note can come on this, you know, and also the long notes also can come on this. So basically we should know the ECG. So this is very important topic. Now we'll start with the what is ECG, you know. So we'll start with the definition of it. Right? So what is the ECG? ECG is nothing but your what? ECG is nothing but the electrical activity of heart that we are recording on a graphical representation. That is nothing but ECG. Good evening, Anjali. Chalo. So what is ECG? First of all, write down the full form of the ECG. Electro, that means which energy we are using. We are using the electrical energy, right? Electro, cardio, which organ it is related to? Obviously the heart, and graphy. It's one word, but I broke it into 3 parts so that it will be easier for understanding. Now whenever the graphy word is going to come, that means we are taking or we are doing some procedure and finally we are making out the output into a graphical representation. We are taking out the recording in a graphical representation, some waves, right? Some upward waves, some downward waves, some straight lines, and then we are interpreting that what is going on inside the body, right? So whenever the graphy word comes, that means it is nothing but a graphical representation of what thing? It is a graphical definition. क्या हो सकती है बच्चों? Graphical representation of cardiac activity, or you can write activity of the heart, right? Cardiac activity, graphical representation of cardiac activity of the cardiac activity, right? Which is measured with the help of electrodes. Electrodes, right? Graphical representation of cardiac activity which is measured with the help of electrode. That is nothing but it's a procedure, right? Whenever the word graphy is going to come, that is nothing but a procedure that we are doing. Okay, so this is the procedure in which the graphical representation of the cardiac activity which is measured with the help of electrode, that is known as. So complete definition will be, it is a procedure in which we are taking out the graphical representation of cardiac activity, which is measured with the help of electrodes. Now, when we say electrodes, what are these electrodes? You must have seen some small, let's see a diagram of it, small things which are attached to the body and through which the wires are connected. Now, what they are actually? They are kind of a receptor. Receptor of what? They are taking those electrical changes that are happening near the heart and which are sending the signals towards the CRO, that is cathode ray oscilloscope, the machine which is processing those signals and giving us the graphical representation. So these are known as electrodes. It is known as 12 lead ECG. Remember, usually we use 12 leads in the ECG. You can use so many leads. There are 15 lead ECG also. There are 18 lead ECG also. But it's not that useful in our regular concern with the patient. Okay. So what we use is 12 lead ECG. Now there are different types of leads. Now what are the different types of leads that are present? Remember, depending on their poles, how many poles that those electrodes are having, those lead are having, depending on that, we divide this 12 lead ECG into two parts. And what are those two parts? Remember, there are bipolar leads and there are unipolar leads. What do you mean by bipolar leads and unipolar leads? Now understand, when we say bipolar leads, that means they must be having two poles. That means they must be having two poles, right? And unipolar leads, that means it is having a single pole or single electrode. Okay. Now, usually when we take a ECG, we attach two electrode and take the difference between two. Okay, and the two electrode combinedly form a single lead. Okay, now if I'm saying there is only one pole over here, that means only one electrode. Now how can I make a potential difference? अगर किसी को भी differentiate करना हुआ, you need two poles, right? Then only you can differentiate. But if I'm saying there is only one electrode, how can I differentiate? We attach a standard resistance and we compare with that. Okay, so that's how it is going to act as a single lead, okay, with a single pole. Anyways, nobody is going to ask you in the nursing exam per se, but anyways, you should know. That's what I told you. Now, how many bipolar leads we are having out of this 12? Remember, there are 3 bipolar leads and remaining 9 are the unipolar leads. Okay, now which are these bipolar leads? Bipolar leads simple है क्या? Lead 1, lead 2 and lead 3. They are the 3 leads which are going to be there in the bipolar leads. Okay, now what about the unipolar leads? Now understand, unipolar, there are 9 leads. So we have to divide it into another 2 parts. They are again subdivided into 2 parts. Now what are the 2 parts? First are known as augmented leads. Augmented. And how are they? They are unipolar. So you can write augmented unipolar leads or just augmented leads. Okay, and there are chest leads also. You must have seen, just now we saw the diagram of chest leads. How many are there? They are from V1 to V6. Okay, so V1, V2, V3, V4, V5, V6. Okay, so there are 6 chest leads, right? And remaining 3 are the augmented leads. And what are the augmented leads? They are AVL, AVR and AVF. Okay, these are the 3 augmented unipolar leads. Okay, so कैसे याद रखोगे बच्चों? First of all, we took 12 lead ECG. Okay, 12 lead ECG में क्या किया हमने? We divided them into what parts? First of all, we divided into bipolar and unipolar. Bipolar, we know only 3 bipolar leads are there. Lead 1, lead 2, lead 3. And unipolar leads, we are having 2 subdivision, augmented lead. What do you mean by augmentation? Augmentation means amplification, and these are going to amplify the signals, and that's why they are known as augmented lead, right? And then the leads which we attach on the chest, they are known as chest leads. So simple, right? And we do have 6 such chest leads, okay? Augmented lead and chest leads. Now let's move on to the bipolar lead. Now remember, when we learn anything, the scientists which contributed to that, we should remember them also, right? And we have to remember one name in this ECG, and that is nothing but Antoven. It is discovered, the ECG is discovered by Antoven. It is discovered by Antoven. It is the name of a scientist. He contributed a lot of things, right? He gave us the ECG. We do not have to do any intervention. We just apply a gel and we apply an electrode, and we get the graphical representation which can help us to diagnose many things, right? So we have to remember this name, that is discovered by the Antoven. He gave the law also, and he gave the triangle also. Let's understand what he gave. Now first of all, about the bipolar leads we are going to talk about, right? He gave one triangle, and that is known as obviously Antoven triangle. Now let's see what is this Antoven triangle. It is very easy. What you have to do is, you have to just make a triangle in a reverse manner, okay? कैसे करेंगे देखते हैं. Okay, now this is known as Antoven's triangle. Now understand, one lead will be attached to right arm, one lead will be attached to left arm, and one lead will be attached to left leg or left foot, you can say, but over here we are going to write left leg. Why is it so? In few minutes you are going to know that, okay? Now understand, there will be a positive terminal and negative terminal in the electrode, right? So over here also we are going to have negative and positive, negative, positive, and negative, positive, okay? That's how you have to remember. Now how you will get to know that where you have to write a positive sign. Now remember, you take the L as positivity sign. More the number of L's, you have to write positive that side. Now over here in the right atrium, you do not have any L, right? So you cannot write positive over there. So over here we are going to write positive and right atrium ka negative in this lead, okay? Now if you talk about the second lead over here, let's take another color. Over here, let's see, there are 2 L over here. So obviously बात है, positive कहाँ लिखोगे? Towards double L, that is left leg. If we talk about another lead, this lead, then over here only 1 L, but over here there are 2 L's. So positive sign you have to give wherever there are more number of L alphabets are there, okay? चलो ये तो सीख लिया. Then there are 3 leads, lead 1, lead 2, lead 3. Simple funda है क्या? If you take over here the number of L's again, what you are going to get? From here to here there is only 1 L in total. So you are going to write it as lead 1. This is lead 1, okay? Now if you take this lead over here, the blue one, there is no L over here, but there are 2 L's over here. So this will become your lead 2. Lead 2, okay? यहाँ पे count करो, how many L's are there? Count over here, 1 L over here and 2 L. Combinedly form 3 L, right? And that's why we're going to write it as lead 3. So that's how you can draw the triangle of Antoven, which is known as Antoven triangle. Now understand the potential difference between these two bipolar leads that we are going to convert into what thing? We are going to convert into graphical representation, and that's how what we are going to get is the ECG in these leads. Okay, now third thing, Anthon gave one law. He said if you know two leads, if you know the potential difference of two lead, you can calculate the potential of the third lead. And how you can calculate the potential of the third lead? He gave one law that is known as Anthon law. Where are the other students? Anjali, only you are there. Anthon law. Okay, chalo. What is Anthon law? He said usually lead 2 is combination or is a sum of lead 1 and lead 3. If you combine lead 1 and lead 3, it will give a sum potential of lead 2. Okay, so it is the average of what thing? Lead 1, lead 3 combinedly, it is going to give a lead 2. Now, if I say I have to calculate what thing? Let's say lead 3 I have to calculate. Lead 3 को वहीं रखो, lead 1 को इधर ले आओ. This is positive. Once you bring it over here, it will become negative. So lead 2 minus lead 1 will become what? It is going to become lead 3, right? Same if I have to calculate lead 1. So it will become lead 2 minus lead 3. It is going to become lead 1. So if you know the potential of two leads, you can easily calculate the third lead. है ना? Suppose इन दोनों का पता है, so you can calculate lead 2. इन दोनों का पता है, so you can calculate lead 3. If you know the potential of these two, then you can calculate lead 1 also. Okay? So that is the Anthon's law. That is the Anthon law. So if you know what is Anthon law suggests, if you know the potential, if you know the potential of any two lead, or better क्या है, any two bipolar leads, you can calculate the potential of remaining or third lead. Remaining or third lead. Whatever remaining third lead is there, you can easily calculate what can be the potential in that lead with the help of the Anthon's law. Okay, so that's how we covered the what thing? Bipolar lead. So bipolar lead के अंदर you have to make a diagram, right? And then you have to write about what is this lead and how we can calculate it. Okay, let's move on to the augmented lead or unipolar lead. Now, what is the augmented lead or unipolar leads? Now, I told you first thing only, augmented leads. Now, what do you mean by augmentation? Now, augmentation, these are first of all unipolar leads, and augmentation, I told you that this means amplification. This means amplification. Now, how much amplified waves you are going to see? It causes the amplification of 1.5 times. It multiplies those, it amplifies those waves 1.5 times more, and then it gives a graphical representation to you as on ECG in these augmented lead. Now, what we are going to do is we are going to attach one electrode, since this is unipolar lead, right? So, see, this is going to make your triangle of what thing, but over here on the right leg also you can see what thing, a lead attached on the right leg. Why it is there? I said only 3 leads are there. Now what is the role of this fourth one? The fourth one is usually for earthing, right? So कोई current ना लगे, कुछ गड़बड़ हो गई तो, so that's why the fourth electrode it is for earthing. ठीक है? Fine. Sure. Now this was the triangle that we saw, है ना? Potential difference just यहाँ लिखने के बजाय उन्होंने क्या लिखा है? They wrote it over here in between. Okay? It means the same. It means the same, right? And the fourth one is for earthing. It's purely for earthing. Now, okay, यहाँ पे So I don't have a diagram for these what leads, augmented lead, but I can make you understand how. We said there are 3 augmented leads. What are the 3 augmented leads? A, V, L. कहाँ join करोगे? A, V, L है. L से you're going to join it on the left arm. If I say A, V, R, I'm going to join it on the right arm. And confusion ना हो left leg में and left arm में. So that's why to avoid a confusion, only one foot we take, right? And that one is the left one, right? So that's why we wrote it as foot. This F is for foot. And which foot we take? Left foot. Now understand why we take left foot only and not the right one. Understand, normally the heart position is like this. It's not vertical in between. It's towards your left side in the mediastinum, and it is slightly tilted. Okay, it's not like vertical. It's slightly tilted towards the left hand side, and that's why if you make a triangle over here, its vector is going to go towards the left side. Okay, and that's why we have to take the left foot over here, because when we take any vector, we have to take care of the direction. And we know that in the first chapter itself, what we talked about, the depolarization, है ना? So if we see over here, the heart direction is like this. It is slightly tilted towards the left, right? You can see that there is left ventricle over here, and the heart is directed towards the left. So heart is, if it is directed towards the left, and if you take the depolarization, so how it is going to get depolarized? It is going to get depolarized like this, है ना? Towards the left leg. So the direction of depolarization in a normal healthy person, how is it? It is towards the left, and that's why we take a left foot. Okay, let's see if I have PowerPoint of that. I can show you that how it is going to get depolarized. Okay, so let's see if I can show you the video how it depolarizes. Okay, chalo. So I'm going to show, see carefully. It is going to show you how it is going to depolarize. So I hope you can see this. The darker color, that means it is depolarizing in that direction. So the average, if you take of all the cardiomyocyte combinedly, how it is going to give you the average? It is going towards the left side, right? Where it is going? It is going towards the left hand side, right? चलो आगे बढ़ते हैं. So it is moving towards the left hand side, and that's why we take left foot. Now let's move on to the chest leads. Let's move on to the chest lead. चलो आगे बढ़ते हैं. Chest lead देखते हैं. When I say chest leads, I'm going to attach the leads on the chest, है ना? I'm going to start it from the right side, and then I'm going to move towards the left. Okay, now let's see where I'm going to attach those leads. Let's see in the diagram itself, and you will be very clear. Now understand, we are going to attach the lead in between the ribs. Okay, this is the better diagram over here. Look, suppose this is a heart, and a heart is usually not like that. We just now saw it's just the diagrammatical representation. Now understand, this is your first intercostal space, you know. This is your first intercostal space. Costal means the ribs, right? And the space between two ribs, what you're going to call it as? You're going to call it as intercostal space, right? This is second intercostal space, this is third, and this is fourth intercostal space. Now understand, the first lead, let's say it as V1. The first lead I'm going to join just right to the sternum. On which intercostal space? On the fourth intercostal space. Okay, I'll make you write, just concentrate on the diagram over here for a bit. Now What about the second lead? Where I'm going to join the second lead? Over here there is a V2. Where I'm going to join the second lead? See, this is the right side of the patient and this is the left side. Okay, let's say a subject. Now understand, where I attach the second lead on the, again, same intercostal space but left side to the sternum. Okay, so first lead on the right side of the sternum, second lead on the left side of the sternum, on the same fourth intercostal space. Where I'm joining this? On the fourth intercostal space. Fourth intercostal space. Right? Now, what about the third one? Just leave it for some time and let's see on the V4. V4. Where I attach the V4, there are lines. Okay. Now, this in the middle, if you draw a line over here, what you're going to call it as? It is going through and through out of the sternum. So you are going to call it as it is going to be a sternal line. Okay. Now, just periphery to the sternum, if you draw again a line like this, which is touching to the bottom, what you can call it as? You can call it as parasternal line. I'll make you write everything. Just concentrate over here. Now, the third line, imaginary line, if I draw between this clavicle, I'm going to call it as mid-clavicular line. Why I'm going to call it as mid-clavicular line? Because it is in between the clavicle, right? I'm going to take the middle part of the clavicle and I'm going to draw a perpendicular line to it. That will be called as mid-clavicular line. Just beside the clavicle, what starts over here after some time? The axilla. Anterior to axilla, I'm going to draw an imaginary line that combines or that denotes the anterior axilla over here. So I'm going to call it as anterior axillary line, then mid axillary line, and then posterior axillary line, right? ऐसे ही हम back में जाते हैं. So vertebral line, paravertebral line, and then the scapular line. Okay, nobody is going to ask you that much. So if I draw another line over here, that will be axillary, and this is a 2D diagram, so they draw like that, but this is the mid axillary. Okay, so V4 आएगा कहाँ पे? Fifth intercostal space. It is going to be on fifth intercostal space. Where? On the fifth intercostal space, mid-clavicular line. So where it is present? On the mid-clavicular line. Okay. Now what about the this one? It is on the same clavicular line on the anterior axillary and then the mid axillary line. Okay. Usually what happens? यहाँ पे थोड़ा सा गड़बड़ ड्राइंग में दिखाया हुआ है. What? Let's write it one by one. Now what we can write is that over here is that we can write what thing? We can write first of all the lines, and then we can write the, you don't have to write the lines in the what thing in the exam. Okay, it's just for your information that I'm writing. Okay, now understand, if I say there are lines, which are the lines? If I go from the middle to the back, first of all there will be sternal line. Okay, sternal line, or we can say mid sternal line, sternal, yeah, mid sternal. Then what I can say? Sternal, mid-sternal, parasternal. Parasternal के side भी कौन सा होगा? It is going to be mid-clavicular. Mid-clavicular line. Then it will be anterior axillary line. Then mid-axillary line. Posterior axillary line. Then posterior axillary line के बाद there is a scapular line, right? Paravertebral line, and then the vertebral line. where this vertebral line is going to come exact in the middle at the back, right? Where your spinal cord is there, exactly in the middle of the back, right? So these are going to be like this. If I'm going from my sternum, from one side towards my vertebra at the back, right? This is going to be the order in which the lines are there. These are imaginary lines, nothing to do with the ECG per se, okay? But to understand where exactly we place a ECG lead, that is very, very important. So let's write the lead where they are placed. See, some diagrams, I took it from the net, so they are not that authenticated. Now there is a mistake in the diagram over here, and what is that? Usually the rib cage is not in the straight line like this. The rib cage, the rib goes like this, okay? It goes obliquely downwards and then moves in the back, okay? यहाँ पे इन्होंने क्या दिखाया है? Let's see. यहाँ पे इन्होंने ऐसे दिखाया, ऐसे नहीं जाता rib cage, right? How it goes? It goes like this, something like this. ऐसे करके नीचे जाता है and then obliquely goes down, okay? This is a V5 and V6, but they shown on the 6th intercostal space. It should be on the 5th. Okay, so एक छोटी सी mistake है in this diagram. Okay, anyways, it took it from the net, so ignore that. Focus where I'm writing this, that is important. Okay, so V1 कहाँ attach किया हमने? We attach the V1 on the 4th intercostal space. ICS means intercostal space. Okay, 4th intercostal space on the right, where paravertebral line. Parasternal line. Vertebra तो पीछे हो गए, है ना? Parasternal line, which intercostal space? 4th intercostal space. I'm not going to attach on the rib. I'm going to attach between two ribs. Okay. Now, what about V2? Same intercostal space, 4th intercostal space, but only difference is on the left side. RT means right, and this is left. Parasternal line. Okay. This means the same. You have to copy. Okay, now when I'm going to talk about V3, I left the V3 over there also and leave the V3 for some time over here. Now I'm going to come on the 5th intercostal space. यहाँ से सारे के सारे किस में होंगे? 5th intercostal space में. Okay, so 2 on 4th intercostal space, 3 on 5th intercostal space. We are going to talk about what thing? We are going to talk about this third one later, right? Just now concentrate over here. 5th intercostal space, where? Which line over here now? It is the mid-clavicular line. And these are imaginary lines. Mid-clavicular line. Mid-clavicular line. Okay? This is again 5th intercostal space, but which line? Anterior axillary line. Anterior axillary line. This is same 5th intercostal space, where? Mid axillary line. Now what about this V3? जहाँ पे भी आएगा इन दोनों का mid point, we are going to attach the V3 over there. There is no specific point of this V3. You have to attach first V2 and V4, and then wherever the midpoint of this V2 and V4 is going to come, over there we are going to attach the V3. So where we are going to join it? Midline or midpoint of, or between, you can write between midpoint of V2 and V4, or you can write between V2 and V4, right? So between these two, we are going to take an imaginary center and we are going to attach over there the V3 lead. Okay, so that is how you have to write what thing? The levels of the lead. Okay, ये तो हो गया आपका lead attachment, right? We'll come towards the waves now. Okay, so how the waves are seen? How the waves are seen? Good evening. Okay, let's see how the waves are seen. Now you must have seen that there are various different waves in the ECG, and what are those waves? Let's learn that. Let's learn that. There are different waves. I'm going to draw a simple diagram of it. P wave, then slight Q. It may be present, may not be present in the ECG, right? Then R, tall R, P, Q, sorry, R, then Q, tall R, Q, tall R, and then T. Now understand, the T should be always bigger than the P. Okay, whenever you are drawing the P and T, always draw a bigger height of this T wave. Okay, it should be taller than the wave P. Okay, and this is QRS. This Q may be present, may not be present. Okay, so let's see one by one. What is this P, QRS, and T? Now, we know that first of all, the pacemaker will start giving its depolarization, right? And when the heart starts to depolarize, first of all, the impulses are going to come from the SA node. As the SA node fires, what is going to happen? The wave of depolarization is going to go where first? In the atrium. So first of all, who is going to get depolarized? The P wave. That means the atria is going to depolarize first. So it shows the atrial depolarization. It is going to show the atrial depolarization. Okay. Now, next comes the QRS complex. QRS complex. In the QRS complex, what it is going to happen? Once the atria is depolarized, and it is going to say, take only 0.1 second, right? So once it is depolarized, what is going to happen? Next, the depolarization will come from through the AV node. It is going to come towards the ventricle. The ventricle is going to get depolarized. Okay. So QRS denotes the ventricular depolarization. It is going to show ventricular depolarization. What about the T wave? It is for the ventricular repolarization. Now, usually these are electrical phenomena. Don't confuse that with the contraction and relaxation. But definitely, yes, this is followed by, so you can write, when the depolarization happens, what is going to happen in the muscle per se? It is going to contract, right? But this is the ECG is an electrical phenomena. It is not the mechanical phenomena. But definitely it is followed by the mechanical phenomena, right? So always electrical come first and then the mechanical, right? So first thing is P wave, atrial depolarization happens, and then it is followed by, it is not the atrial contraction. Atrial contraction is totally different. Atrial depolarization is totally different. Depolarization means that there is some electrolyte changes are going to happen, because of which some potential changes are going to happen, right? And when we say contraction, that means actually the muscles are showing the mechanical phenomena. They're contracting. They are totally different. Okay. So but it is followed by, this depolarization acts as a stimulus for the muscle, and the muscle then is going to contract, right? Now, it is followed by atrial contraction. Atrial contraction. Now, what about the QRS? It is followed by, I'll just write F-B, that is followed by ventricular. Obviously depolarization है, तो क्या होगा? Again contraction, right? And the ventricular repolarization. Now the opposite thing is happening. So contraction का opposite क्या होता है बच्चों? Relaxation. So RE for repolarization, RE for relaxation. That's how you can remember. Ventricular relaxation. It is followed by ventricular relaxation. Understand? These two things are different, but definitely they are related with each other. They are totally different, but they are associated with each other, right? So these are the electrical phenomena over here, which is followed by mechanical phenomena. Right? which is followed by mechanical phenomena. Now you will ask me, ma'am, आपने तो बता दिया कि atrial depolarization and atrial repolarization is ventricular depolarization, ventricular repolarization is happening. Where is the atrial repolarization? Does the atria doesn't contract or doesn't relax or what? Remember, what happens is whenever we are taking ECG, there are lot many electrolyte changes happening in many cells. So we apply one filter into the ECG so that whatever rest of the potential differences that are happening in the rest of the cells, we do not want our ECG to get errors in between, right? So we attach a filter. So what the ECG is going to do is that the highest amplitude of wave it is going to get, only it is going to represent that graphically on the graphical paper, okay? Rest all the waves which are having less potential, it is going to filter it out and it won't show on the ECG paper, okay? And what happens in the atrial relaxation, whenever the atria is relaxing, the same time the ventricles is contracting and the more force is generated at the same time in the ventricle, and the force is actually released, the tension is decreasing in the atria, right? So what is going to happen? Which one is more powerful? Obviously more powerful will be your ventricular contraction as compared to atrial relaxation, right? So first thing is ventricular muscles, they are more thick, okay? Second thing, they are contracting, not relaxing at that time. So actually atrial relaxation happens at the same time when the, or atrial repolarization happens at the same time when the, what is happening? Ventricular depolarization is taking place. So यहीं पे क्या हो जाता है? Atrial repolarization, but it is not shown in the ECG, or we are not bothering about that. Why? Because it is filtered out by the ECG machine itself, right? So as to avoid the error between the Qrs complex and the atrial repolarization. Understood? So that's why we never talk about the atrial repolarization. But remember, the atria is relaxing at the same time when the ventricles are contracting. Okay? Now, next funda. Whenever, if I talk in between lines, there are straight line, you can see over here there is a straight line, right? And over here also there is a straight line. And after T wave, there will be straight line also. Next will be the P line, right? So there are straight lines available over here. Now we are not bothered about this wave right now. So there are two main straight lines. If there is a straight line coming in between, you have to remember straight line, S for straight line, right? And S for segments. Okay? If I say PR segment, I'm not talking about PR interval that we learned. I'm talking about PR segment. So that means it is going to consist only and only straight line. It does not include any wave. Okay? So you have to exclude all the waves. You have to just take the straight line. Okay? Now, if I talk between these two things, that is between the S and T, I'm going to have a straight line. So what I'm going to call it as? ST segment. So easy, very easy, right? So these are the segment which I drawn over here in the green. Okay. Now let's learn about the one more thing, that is intervals. Now what are the intervals? Now if I include a wave in the segment, either one wave or two waves, if I include a wave, that becomes interval. We cannot say that is a segment. Why? Segment is only just the straight line. Okay, we do not usually include the wave in the segment, but if the wave is included, if I have to measure the duration from the beginning of the P till the starting of the Q, that is called as PR interval. Okay, so write down what is PR interval. PR interval. What is PR interval? Remember, PR interval is starts from the beginning of P wave till the beginning of Q wave. Usually the Q wave is absent. You cannot see the Q wave is very teeny tiny, and that's why sometimes, most of the times, you cannot see the Q wave. So what is better to write? Beginning of R wave. Why? Because R is always going to be there, right? So that's why it is called as PR interval. That's why it is called as PR interval, from the beginning of P till the beginning of R. I'm not going to include the R. I'm saying till the beginning of the R. Okay? There is another interval. What is that another interval? If I take the interval from the S wave till or if I take the interval from the Q wave, beginning of the Q, till the end of the T, what we are going to call it as? We are including Q as well as T. So I'm going to call it as QT interval. Cute interval. Hey, cute. Beginning of, I'm not going to write that again and again. So beginning of Q wave till the end of, over here there is an end of T wave. So I'm including two waves over here, right? QRS ka pura complex I'm taking, and also the T wave I'm including in this, right? So Q and T wave. So this is interval. So what's the difference between interval and the segment? If I write segment, I have to take only the straight line. Only the straight line. Okay? Now, what is the importance of this PR interval and all? Remember, once P means SA node must have been fired over here, and that's why the depolarization is started in the atria, right? And over here, if it is reached, or let's say R wave tak ye reach kar gaya, that means it is the duration which is required for the wave of depolarization to reach from the SA node till the ventricle. Okay, so it is showing how much time it took from the SA node to the wave of depolarization to reach to the ventricle, from the SA node towards the ventricle. Okay, so this is the duration that is given by the PR interval. The same thing we can write it in the QT interval. What the Q and T is denoting? I'm including the ventricular depolarization over here also, and I'm including the ventricular repolarization also. So the PR interval, first of all, it is denoting how much duration it took. Duration required for the depolarization to reach, or depolarization from the SA node to reach where? Ventricles. SA नोड से फायर होने के बाद कितनी देर में सिग्नल्स गए कहाँ पे? वेंट्रिकल तक. सिंपल भाषा में, दैट इज योर PR इंटरवल. ओके, नॉर्मली कितना होता है हमने पढ़ा था कल? 0.12 to 0.2 to 0.2 seconds और 0.20 seconds भी लिख सकते हो आप, राइट? सो इट इज दैट लेस. ओके, अगर इससे ज्यादा टाइम लग रहा है, इफ इट इंक्रीजेस more than 0.2, we are going to say it as there must be something abnormality, some obstruction is happening. We are going to call it as AV block. Usually the problem is in the AV node. Okay, so that's why there is some blockage happening in between, and that's why it is taking what thing? That's why it is, or it must be taking more time, and that's how we can identify that yes, there must be some problem which is going in between, and that's why what is happening, that is taking more time, right? Now when we talk about the QT interval, so what we say, when we talk about QT interval, it is showing or representing how much duration It is required for ventricular phenomena. And what do ventricular phenomena? Duration or time required. It is showing the duration or time required. Better term is time required or duration it took. For what thing? For both the thing, ventricular depolarization and ventricular repolarization. Depolarization से लेके repolarization में how much time it took. That means once it depolarized and once it repolarized, right? So whole total phenomena of the ventricle depolarization से लेके repolarization तक कितना time लगा, that is told by your this QT interval. Okay, that is not much importance of much importance, but yes, PR interval is of much importance, right? Now, if we see the diagram of it, पहले तो आपको ECG पे शॉर्ट नोट आया तो क्या लिखना है बच्चों? पहले तो लिखो कि कैसे कैसे हो रहा है, राइट? ECG बेसिक वर्ड में मैं अगर बताऊं, सो क्या है? हमने लीड अटैच कर दी, राइट? We attached a lead. Now those leads, what they are going to take? They are going to take up pictures from that side. See, what we do usually, I give the example in the class also that usually the girls do these things, that they click a picture from the different angles, right? Suppose I have a pimple over here. What I'm going to do? I'm going to click a picture from here so that the pimple does not see, right? It is not seen. Now, if same thing happened in the heart, suppose there is an abnormality on this side, okay, but I only take the picture, or if I only see the heart from this side, another side, I can miss what thing? I can miss the lesion on the other side. So what I can do is that I'm going to attach a leads everywhere. That means I'm going to take a picture from every side, so that even if a single pathology is there at any side, what I can do? I can get that pathology so as to treat that pathology, right? I can do that, right? So that is nothing but a picture that we are taking as a electrical, what thing? As a electrical phenomena over here, right? So that we are doing in the ECG. So this is like a picture, taking a picture. What is better, bacho? Taking a picture is better or a video? Always a video will give you a motion, will give you a better idea of what is the condition of the heart. The ECG is same as taking picture from different angle, just that it's not those pictures that we take in reality with the smartphone. It is electrical picture and it is having its own way to show off, and that is a graphical representation, right? So it is like taking a picture, right? And when we take a what thing? Video, that is nothing but we take motion pictures, a moving picture, that is nothing but echo, right? That is echocardiography. What we do, we put an ultrasound probe over there and we look actually how the flow is coming, how it is going, how the ventricles are contracting. In a picture you cannot see the contraction, the movement, right? You can just see whether you can just guess that yes, it is a major abnormality. If it is there, you can check that. But if it is a slight narrowing, you cannot see. Suppose there is a problem in the valve, you cannot see with the ECG. You have to do the echo, right? So that is there. Now, last thing that we are going to learn is the cardiac axis. Remember, when I'm going to circle around it, if I make a 360 degree of circle of this leads, so how it will be? It looks exactly like this, okay? Exactly like this. Now what is this? 1, 2, 3. They are the 3 bipolar leads, right? These V1, V4, V1 to V6, V1, V2, V3, V4, V5, V6, they are the chest leads, and the rest of them, that is over here you can see AVL, AVR and AVF. What are these? These are augmented leads, right? So that's how it looks like. If I draw a axis over here, जैसे हम maths में draw करते थे, if I draw a axis over here, there can be some points, degrees we have to write, right? So I suppose I draw a horizontal line with this I'm going to call it as 0 degree. From here I'm going to call it as -30. यहाँ पे I'm going to write 90 degree. यहाँ से 90 degree से 120, 120 से 60, right? ऐसे ऐसे करके 0 से 60 से like 90, 120, somewhere over here I'm going to get 180 degree also, right? यहाँ से माइनस में चलते हुए आते हैं -30, यहाँ पे आके कहीं पे -90 होगा, right? It is nearly about -130 or so, and again I'm going to come back to 180. Okay, now understand why it is important to know the cardiac axis, because if you summate the you summate the potential, it is going to give you a vector. Okay, this diagram we already drew, right? So क्या है ये P wave, then PR interval, PR segment, this is ST segment, ST interval, right? ST interval में क्या आता है? हाँ, ST interval में from the S at the end of S till the end of T. Okay, ST interval, QT interval, we already learned that, and this is a QRS complex. Okay, so this is a typical diagram of ECG. Okay, क्या याद रखना है? S means straight line, that we already discussed. चलो axis पे बढ़ते हैं बच्चों. If you want the screenshot, you can pause the video and take the screenshot over here. Okay, चलो. Now अगर मैंने ड्रॉ किया एक्सिस somewhat like this, it is going to look like, okay, somewhat like this it is going to look like. Now understand, if I calculated wherever I got the wave of depolarization, what I said, I'm going to take a mean vector, average कुछ तो लेना है मुझे, right? I'm going to take the average direction of what thing? I'm going to take the average direction of depolarization. हमें पता है क्या? Suppose this is the heart. Suppose this is the heart. I know my drawing is a bit pathetic, but anyways, better for the understanding. Okay. So suppose this is the left atrium, left ventricle, right atrium, right ventricle. Okay, now understand the SA node will be somewhere here, right? AV node here, then the bundle of his, then the bundle branches, right? Once the bundle branches, there are two types of bundle branches. If the bundle branches is supplying to the right ventricle, we are going to call it as what? Right bundle branch, right? It is going to have branches, and they are also going to have further branches. What we are going to call them as? We are going to call them as Purkinje fibers, right? Now same thing is going to happen. Left bundle branch, which is going to supply to the left ventricle, it is again going to have what? Purkinje fibers over here, right? They are further divided and going to depolarize each of the cardiomyocyte. Now understand, if I take a average direction, it is going to be something like this towards the left side, right? And that's how we show the vector. So that's why we say there should be a normal range. If the healthy person is there, there is an average thickness of the heart and average direction of the depolarization that we call as an axis, and this axis is denoting the depolarization of the heart. That's why we say it as cardiac axis, right? Now look over here, यहाँ पे लिखा हुआ है क्या? -30 से लेके +90 तक you are having a normal cardiac axis. Okay, so understand, if I write what is the normal cardiac axis, it is going to lie in between -30 degree to what thing? -30 degree to +90 degree. -30 degree to +90 degree. What if the average direction is shifted, right? अगर suppose करो the direction is changed in this manner, right? अगर +90 से भी above चला जाता है, so what that means? That means some abnormality is there, right? If the axis is shifted that side, that means either just happens in the pregnancy. What happens? Diaphragm is there, right? The baby is growing in the mother's uterus. The uterus push the diaphragm upward and upward as the baby grow inside the uterus, right? So what happens? Actually, the diaphragm is lying like this. Okay, जब diaphragm push होगा, so heart भी push होगा, right? So heart actually अगर position ऐसे है, so if the heart is positioned like this, it is going to get tilted like this. Okay, so obviously बात है क्या होगा? The vector or average direction is also going to change, but it will remain in the between this normal axis. Now, if the female is also having the left ventricular hypertrophy, it will take more time to depolarize what thing? The cardiac myocyte. Why? Because they are having more size, right? So it will take more time to depolarize left ventricle, and that's why the axis even shift further. The average direction we are taking, it shift towards the left, right? And that we are going to call it as left axis deviation, LAD, left axis deviation. So look over here. If I draw a simple circle and I denote 0, 180, minus 90, plus 90. Normal मैंने क्या बोला? मैंने बोला -30 से लेके +90 तक, it is normal axis. So this is going to be a normal axis. Again, this is taken from the net. Okay. If I say from -90, if the graph is from the -30, if the graph shifted towards more negative degrees, then it is going to be called as left axis deviation, right? अगर ये वाला इस वाले quadrant में आ जाता है, then what we are going to call it as right axis deviation. अगर ये वाले quadrant में आ जाता है, तो we are going to say as extreme right axis deviation. आपके लिए ये जानना सब कुछ ज़रूरी नहीं है. For the nursing student, nobody is going to ask this. But in the medicine, later on, when you are going to learn the ECG, this is definitely going to help you out. Okay? So, अगर short note आता है, तो what all things you have to write? Understand. First thing, what you have to write is ECG में. First thing, write the definition. What is ECG, right? Then you can write about the name of the scientist, that is Anthon. एंथोवन के बारे में लिखो बच्चों. उसके बाद क्या लिखोगे? What are the leads? That is 12 leads. You have to describe the 12 leads. एक छोटा सा चार्ट बना सकते हो जैसे हमने अभी बनाया, right? You can draw a short and smart chart. Okay, then explain each type of leads, है ना? So further explain it. Explain the each type of lead, right? Explain करने के बाद क्या करोगे आप? Explain कर दिया, then उसके बाद क्या करोगे? Leads के बाद explain कर दिया, then what you are going to do? Then you are going to come all the waves. Okay, all the 12 types of lead. Why is it called so? Where they are attached, positive, negative, Anthon's triangle, Anthon's law. इसमें सब कुछ बताना है आपको. Anthon's triangle, Anthon's law, सब कुछ बताना है इसमें. ठीक है? Then waves में आ जाओ. Normal wave draw करो और उसको क्या करता है वो लिखो. What it depicts or what it denotes, it represents. For example, P wave represent what thing? It represent the atrial depolarization. This represent this, right? Qrs represent ventricular depolarization. T wave represent the ventricular repolarization. Okay, class में मैंने आपको U wave भी बताया था. So what is U wave? Usually it is absent. Usually it is absent, right? But in some condition it can be seen. Now exact reason of the U wave is not known to anyone, right? But yes, what the scientist says that if there is a QRS, patient को कोई symptom नहीं है, everything is fine. अगर आप chemical जैसे trop T, trop I करते हो, वो भी normal आ गया. So and you saw a U wave, that can be normal. What U wave, how it comes or what it denotes? Remember, some say that it denotes the papillary muscle. मैंने आपको बताया था, there are some muscle and tendon which helps the valve to be competent, है ना? Valve means it is going to open in only one direction. What is that? Suppose there is a valve between the atria and the ventricle, they are going to only open up downward. Whenever the ventricle is going to contract, they are going to push like this, right? But they are not going to open up like that. If they open up during the ventricular systole, the whole blood will go from the ventricle into the atria. We cannot allow that, right? To support those valve, we have something over here which can attach to this valve and keep those valves competent. Okay, so अगर मैं draw करूँ ऐसे हार्ट को, सिंपल से हार्ट को, okay, now understand. यहाँ पे मैंने बोल दिया क्या है, valves are present. Okay, so अगर मैंने बोला यहाँ पे ऐसे valves हैं, right? To support these valves, I need something which can hold these valves whenever the pressure inside the ventricle is higher. Now, to generate such amount of force to hold against the ventricular valve, we take the help of the muscle. Okay, and the muscles are always attached to the tendon. ये वाले छोटे छोटे muscles जो होते हैं, इनको बोलते हैं papillary muscle. Okay, and उससे attach जो tendons होते हैं, उनको बोलते हैं chordate tendon. Okay, they are known as chordate tendon. Okay, यहाँ पे see over here. So these muscles over here you can see. Just give me a minute. Okay, so look in this muscles. ये वाला आपका ventricular muscle है, but you can see a small muscles which are coming over here. These small muscles, है ना? And these white fibers which are coming, they are the tendons, and this is the cusp of the valve. This is the cusp of the valve. This is the valve actually, है ना? And the valves are attached to the tendon, and the tendon is attached to the muscle, and that muscle is attached to the main cardiac muscle. Okay, so ऐसे इसका representation होता है, and that's why the valves are not open in the opposite direction, right? So everything has its own reason. Over here also you can see that there are muscles which are coming, and again it is attached to the tendon, and tendon is attached to the cusp of the valve. Okay, so वापस आते हैं हमारे U wave पे. So what is the U wave and why the U wave is coming? Now understand, when I'm saying the U wave is because of the papillary muscle relaxation, or it can be said as, यहाँ पे इसका अगर they say repolarization होता है और relaxation होता है, then it comes, and or it can be because of Purkinje fiber repolarization. दो थियरीज है वहाँ पे. एक थियरी बोलती है कि बिकॉज ऑफ दिस पैपिलरी मसल के रिपोलराइजेशन की वजह से या रिलैक्सेशन की वजह से एंड द पर्किंजे फाइबर के रिपोलराइजेशन की वजह से. द मोस्ट एक्सेप्टेड थियरी इज दिस, पर्किंजे फाइबर का रिपोलराइजेशन, दैट इज गोइंग टू गिव यू व्हाट? दैट इज गोइंग टू गिव यू द यू वेव. यूजुअली इट इज नॉट सीन, in the normal ECG, but yes, sometimes it may be seen. बट ये सारे लीड्स में नहीं दिखेगी. अगर सारे लीड्स में आपको यू दिखाई दिया, एंड देर आर सम चेंजेस इन द टी वेव ऑल्सो, टी वेव बिकम टॉल एंड टेंटेड, एंड देन you are going to see the U wave also, then most probably अगर टी वेव की एम्पलीफिकेशन हो गई, इसका हाइट बढ़ गया, we say it as tall T wave, tall tented T wave, plus you are going to see the U wave, then definitely it's a sign of hyperkalemia. Okay, you can write that thing also. You can write something about the cardiac axis, right? At least you can write that it is the average direction shown by this axis, right? And the normal cardiac axis is what? -30 to +90 MV, right? All the things that we discussed. See, this is just a review, okay, for your short note. The rest of the things in the detail we discussed in the class already. Okay, so that's all guys for today's class. I hope you understood all the things. If you have any doubt regarding the ECG, you can write in the group of MedSpa. And thank you very much for attending this class. So best of luck, and that's all for today's class. See you in the next class. Okay, chal, bye bye, good night.